Are we ready?
Yes.
Are we good? Are we good?
Yes.
Are we ready?
Each page?
Initial. But you can share.
More units.
Martin. Where is he?
So can we just do like Yes.
Exchange.
Yes. Like the last person.
Where is he? Oh, yeah. Secretary. What ulikuwa na kuajiri?
Sign. That is just communication. Lazima usome.
Are we good?
Yes.
Let me check the documents.
We sign all the things.
Yes.
Yeah, because one will go with the meeting.
Martin, insurance is help me.
Yeah. That is the point that
Okay.
Viva, Gavana, viva!
we have to polisi hiyo kazi.
Sasa tupigwe kabisa kamoja.
Okay. We
Yes, good.
Dafi ya kuja hapo katikati. Miskela aende huko.
Give us a smile, please, in 3, 2, 1. Thank you. Viva!
Please focus on the hand that is being raised, Excellency. The hand that is being raised, focus on that camera. Thank you. Thank you.
Thank you.
So we read the statement. The second one and the union officials complete the Bible as it does
We are ready?
A minute.
We are ready?
Just a minute.
Mataa ziko sawa?
We are ready?
We want to go live.
Tuko sawa? Haya. You are ready, eh? Ready?
Yes.
Yeah, you can see we are all smiling this afternoon. When we came in the morning, we were not smiling. And therefore, the meeting is white smoke. Press statement on the constitutional meeting regarding the ongoing doctor strike in Kiambu County. This press statement is the members of the press and our country by the Council of Governors. Today, the Council of Governors Executive and Health Committee convened a meeting between the County Government of Kiambu and Kenya Medical Pharmacists and Dentists KMPDU to resolve the outstanding matters following the 4 months long partial doctor strike in Kiambu County. On 29th of April 2025, the Kenya Medical and Pharmacists and Dentists Union KMPDU issued a strike notice citing key issues pertaining the welfare of the members in Kiambu County. Following the notice, a strike commenced on 27th of May 2025, and it is noted that 272 doctors out of 370 were not on strike in Kiambu. In this regard, Kiambu County has made considerable progress in addressing the union concerns by engaging an extra 90 doctors and 200 nurses during the period of strike. Both parties agreed that the issues in the strike notice had been agreed upon and that the conciliator appointed by the Ministry of Labor, except non-remittance of union dues and payment of salaries withheld for the period of the strike. We have successfully deliberated and resolved the issues and will therefore address you on the resolution from our meetings as follows. Number one, payment of doctor salaries withheld for the period of the strike. It was agreed that the county government of Kiambu will pay 1 month's salary to the striking workers immediately upon them resuming duty, together with October salary. This is an assumption that they will return to work today. The pending 3 months' salaries will be paid in the next financial year, that is 2026-2027. Secondly, non-remittance of union dues. The county government of Kiambu will reinstate the deductions and union dues immediately. The pending union dues will be paid as per the return to work formula. That is the pending dues that had not been deducted during the time when we were on strike and there before when Kiambu government stopped deducting the dues. Thirdly, on non-victimization, it was agreed that there shall be no victimization whatsoever by the employer to the members who took part in the ongoing strike. In conclusion, as we conclude, we call upon the county government and the union to embrace dialogue to ensure that the contentious issues are resolved at the soonest time possible, so that the service delivery in the health sector is uninterrupted. We appeal to the doctors to always remember the highest goal, which is to protect and preserve life. We urge all doctors in Kiambu County to accept the goodwill which has been extended by the county government and for the KMPDU to call off the strike so that the people of Kiambu can continue enjoying the services they deserve from the government. We remain committed to the doctor's cause for the betterment of the lives of Kenyans as a Council of Governors, signed by all of us here. I truly, Modon Luki, and Somad, the Chair of Health Committee of the Council of Governors, Dr. Kimani Omotangi, the Governor of Kiambu County, and yours truly, Dr. Dabdi Atal, the National Secretary General and CEO of Kenya Medical Practitioners and Pharmacists and Dentists Union, who I would like to call to confirm signed, return to our formula, and most importantly, call off the strike so that of the health can be able to speak after you call this off the strike. Thank you.
Yeah, thank you so much, members of the Fourth Estate. Thank you so much, Council Office, for convening this regular meeting. And thank you so much, the members of Kiambu County, for turning up for this meeting led by the governor. I also want to thank the doctors of Kiambu County that have all fought over this matter for quite a long period, and also the leadership of the union, both national and the branch, for this particular occasion that led us to this discussion. As you are all aware, and this is a matter that has been in the public, we have been on the strike for over 150 days, based on many issues that are going through the matters of promotions, the matters of statutory deductions, the matters of medical insurance, and the matters of salary delays. We've had a total number of 18 different meetings to bring these matters to an end, but there were some that we could not agree on, which needed the principles of the governor and the COG and our national team to actually lead on. Now I want to say that we have a return to work formula that has been signed today that gives timelines on the pending promotions within the county. Those that are going to be done within 2 weeks, and those that are going to be done within 6 weeks. And that is a clear expression of goodwill on that particular matter. The matters of salary delays, we have been given commitments that when work is well done in Kiambu County, then the council's revenue will be fit enough to ensure that there are no delays of statutory deduction, the remittances, something like Social Aid Authority and other deductions. And we've been given assurance that by 9th of every month, all those remittances will have been done. And that's something we accept as an expression of goodwill. We have the issues of medical insurance also has been discussed. We've discussed all the matters that are pertaining even to the transfers and agreed upon them as well captured in the return to work formula. We have also, one matter that we needed was the employment of more doctors. We may say that this strike, the good thing that happened with it in a very good way is that the county managed to employ more doctors. We need more doctors in the country. And therefore, that means we have more membership. That means the members of the people of Kiambu County can get more services. And I want to thank the governor for getting more doctors. And I will ask him to even employ more, because one of the counties with the highest population across the country is Kiambu County. So that's something that is positive. It should not only be during the strikes. We need to have many more engaged, and we need to have more services being offered in the county. The issues of salaries, well, after this employment was done, it was clear to us, based on our negotiation, that that particular money that was meant for these particular doctors was used to get more doctors and more nurses and more healthcare workers in the county. But it's prerogative for the county and the union, under the guidance of the COG, to agree on the framework to have this money paid. That's why we have resolved today that the money for the month of June and the month of October will be paid immediately after resumption. Then the month of July, August, and September will be paid in the financial year 2026-2027. And we all know that we'll just reach there. We have also agreed that the issue of the union, or members being part of the union, being legally able to be represented by paying the union dues, we've resolved and agreed on a way forward for it. And based on that, because these promises mean nothing if they're not implemented. And today, based on our discussions, we have been expressed for goodwill that they will be implemented. And this return to work formula also will be adopted in court as a court order. I want to say that the strike that began on 26th of May 2025, that has now gone for over 150 days, is hereby called off.
Viva, KMPDU, viva!
And given the nature of the longevity of the strike, I am so certain that not all doctors are within the locality. And therefore, we are asking the doctors that, given that it is weekend, they start traveling back and be resuming their jobs on Monday next week, up to Monday next week, 8 a.m., to report to their duties from that time. So you are asked to start traveling from wherever you are, whether you are abroad or locally. You have enough time, because we do not know when this strike will end, but now it has ended because of the goodwill and the discussions to report to their work duties by Monday, 8 a.m. Otherwise, thank you. Viva!
Viva!
I think one thing is coming out very, very clear. First and foremost, I want to congratulate the doctors led by their union, to congratulate my brother Omatangi and his whole team. In the art of war, sometimes one thing was coming out very clear: 150 days, a lot of swords were removed, a lot of arrows were removed, a lot of words were said, a lot of harm was caused. But I think what is most important is every single person has agreed to allow everything to stay behind so that we can be able to concentrate on the matters of health for Kiambu and the matters of health in Kenya in general. One thing, however, that did play out was it is important for politics to stay out from the health sector. This is something that every single one of us are in agreement. All the governors are in agreement. We need to ensure that politics stay out of our hospital wards, politics stay out of our operating theaters, politics stay out of anything that is talking about the life of Kenyans. By next week, as the council, we are contemplating doing a whole retreat with national government as well, where we want to be able to just draw some lines on what needs to be able to be done. People will always be able to shrug shoulders, but we shouldn't reach a situation where we are staying up to where we are 150 plus days without any solution. That is not the direction that we are going to be taking. And amongst the things that we need to be able to agree on as well, because I know that the governor will be talking about it, but I told him that sometimes hardship creates situations that later on become good situations. By virtue of the intern nurses and doctors and the strike going on, Kiambu ended up hiring more and more people. So probably that is something good that came out. But I think a proper formula that if there are going to be any interns that are going to be working at county facilities, what is the rule of engagement for these particular interns, for both the nurses and the doctors, and for those who want attachment, for those who are working or rather studying at the nursing schools, what is going to be the rule of engagement? So we have a standard operating procedure, and that we don't take advantage or someone else takes advantage of us in any other situation if, God forbid, that it does arise. However, I want to congratulate dialogue, sensibility took the better part of the day, and we are where we are here today. I believe that we will not be returning here. The next time we see our doctors is because they are to give us medicine and not injections. Thank you very much. The man of the moment, the man of the day.
Thank you very much. Let me start by saying that as the county government of Kiambu, as the governor, we appreciate the effort that has been put by the Council of Governors. It is important for us to emphasize that health is a devolved function. And so when issues have to be resolved, we found it necessary to involve the Council of Governors so that it can be also a precedent setter, so that if there are other such issues, then governors, my colleagues, would know that this is the place to come to have those matters discussed. Secondly, let me also appreciate the union today because they've come out and I believe that should be the spirit moving forward. I want to adopt the words of my chairman here, the governor from Mombasa, that indeed if there's anything that would happen that is very bad for our health sector and for the progress of our country, is politicizing development and especially health. And because I dare say that in the first place, if politics and politicians were not part of the mix and match of the strike that has been on in Kiambu, would not have been here today. And that is exactly what I said to the team here, that moving forward, we want to have a proper engagement, direct engagement with the union when they have issues, so that we can solve them. However, in the period that the strike was ongoing, we did what we had to do. We offered health services. We ensured that we employed doctors so that services can continue in Kiambu. And I want to also take the opportunity because a lot of falsehoods were also, peddled at that time. Not necessarily by the union, but by people who rode on the strike. There were stories about 136 babies dying, which is a fake, a very big fake. The owners of the data are here. The Council of Governors keeps records. Kiambu County, as I've said before, is one of the counties that was cited at the United Nations General Assembly, the 80th session in New York, as the county in which one of our hospitals has moved beyond what was expected of any developing nations. That for 8 continuous months, there was not a single death of any child in our hospital. That's the record. Out of all the 47 counties, Kiambu ranks number 24 in the lowest of those that have maternal death rates. Yet, we have the highest number of patients. I want to confirm to the nation that every year, Kiambu County sees more than 5 million patients, 5 million in all our facilities. We have 14 level 4 hospitals, and we have another almost 100 level 3 and level 2 hospitals. None of those facilities either is lacking of medicine. We are one of the counties that have already installed a proper modern hospital management information system. And that's why our doctors are happy. Let me say to Kenyans at large that the hospitals in Kiambu, as we serve in our referral hospitals, other patients, that they have been fully operational and you could still come. The chairman of the Secretary General and team, we also now want to invite you this time to Kiambu, because the last time when you came to the streets. Now come to the hospitals. And you can see for real, because when you were in the streets, you were using information that was given to you by third parties. This time, we'll take the responsibility to take you through the hospitals yourselves. And let this be a process. And we believe that the purpose of the union is not contrary to what the functions of county governments are, or the intentions of county governments. We should be allies to ensure that as you fight for the rights and the well-being of doctors, that it is supportive of the work that we are undertaking. And it's on that basis, SG, that I want to invite you and the team. We have promoted 770 doctors, healthcare workers, since I came to office. We have replenished our fleet of ambulances, bought 18 new ambulances to replenish and change from a system where we were hiring. I have built 6 new level 4 hospitals in Kiambu and 26 new level 3 hospitals. We shall be commissioning them from this end. And so, if the new members of the press, we shall be inviting you, our chairman of the Council of Governors in Health, our whip, plus the Secretary General. We are going to make you a guest of honor in the opening of those functions. So that then you can see that we are serious people. As the governor, I want to close by saying that our doctors are our friends, and I want our doctors to be working all the time. They are part of my workforce. I have a workforce of about 7,000 workers in Kiambu County. And the doctors are part of that workforce. I want us to work in unity and all recognizing that we are there to serve the public and not personal interest. We have no problem with the doctors. Let them come back on strike. And we want to also congratulate and say thank you to the more than 270 doctors who continued to work during this time. It is important for us to say so. And for those that are returning, please return with good spirit. Enjoy your colleagues who've been working. And let's build a better Kiambu. My mantra is making Kiambu great again. And we want to see that happening and feel it close. So thank you very much. God bless. And I know we shall attain those goals. Thank you.
Mubarikiwe.